Today's stories. The City of Toronto partners up with Vaccine Hunters Canada. Unclear answers if Formula One will race in June. Canada hints it may adopt vaccine passports. Another Canadian province receives help from the military to beat back third wave of COVID-19. More restrictions in place in Alberta. Supply of the AstraZeneca vaccine in British Columbia runs low. Hello everyone, you're watching Eagle News Canada. I'm Tiffany Alisassis reporting from Calgary, Alberta, bringing you stories from across the globe. Living in Toronto and wondering where to receive vaccines? Eagle News correspondent Yolanda Asprias tells us how.
In order to reach and encourage more people to get vaccinated, the City of Toronto has announced Wednesday its partnership with volunteer-run organization Vaccine Hunters Canada. This community of volunteers has gone viral in the last few weeks as they help Canadians navigate, monitor, and spread word on COVID vaccine rollout. They assist in informing and connecting eligible people with appointment opportunities nearest to them. Vaccine Hunters are not tied to any political party, business, or organization, and yet they have become popular with Canadians looking to promptly find and get vaccine appointments. The organization uses various digital tools to gather tips from different parts of the country as to when and where clinics open up. It uses the popular messaging platform Discord to gather, share, and verify appointment information in the regional level. Vaccine Hunters also shares what people need to bring, length of lineups, vaccine supply levels, with an added conversational friendly tone to all the more encourage people to book their appointments and get vaccinated. Vaccine Hunters was established last March 19, and in a little over a month, it has helped and continue to help thousands of Canadians get vaccine appointments. In partnering with Vaccine Hunters Canada, the City of Toronto will be providing the organization with first-hand information on next-day clinic appointment availability in different areas of the city. When asked whether the City of Toronto feels any embarrassment that a volunteer-run organization seems to be doing much better than the government in informing people about the vaccine rollout, here is what Mayor John Tory has to say.
I mean, I admit that for people keeping up with all these different rules that are put in place by the province and different clinics operated by ourselves, by the hospitals and others, has been daunting for people to deal with. But our objective, and we've had all kinds of partnerships, and we call them that because that's what they are, people working together in a common cause to get people vaccinated and make it as easy as possible. And I take great pride in the fact that these people are out there, and great pride in the fact that Chief Pegg and the city organization said, let's make sure we work as closely together as possible. So all it involves is us giving them a roster of available appointments and them making those through their channel known to people, which in turn hopefully makes it easier for people to hook up. To me, this is an entirely good news story. There's not a bad news aspect to it.
Vaccine Hunters Canada expresses their gratitude to be working with the city. Our partnership with the City of Toronto is just one more important means to share accurate, timely vaccine appointment information to as many people as possible, as quickly as possible. We look forward to building our trusted network of public health units, pharmacies, and vaccine clinics from coast to coast. In Toronto, Yolanda Aspiras, Eagle News. We live in interesting times.
Formula One did not confirm to race in Montreal this June. Answers are unclear as negotiations continue. Eagle News correspondent Andre Lajoie with the story.
Formula One did not confirm to race in Montreal this year in June. Answer unclear as negotiations continue. Formula One officials are appealing to various levels of the government to invest $6 million to bring the Canadian Grand Prix back to Montreal in June, but it's unclear how Ottawa will respond. The race was first postponed and then nixed last year, and now F1 needs the money to offset the cost of the presenting of the event this year without spectators on site. The race usually attracts thousands of tourists from around the world, but with the third wave of COVID-19 picking up steam, bringing all those peoples together in one place to watch cars zip around the Gilles Villeneuve track is out of the question. F1 officials are also asking to bypass the mandatory of 14 days quarantine for hundreds of staff, crew members, and drivers. They would instead rely on private medical staff and keep COVID from spreading among the personnel. We learned that Quebec Public Health would be ready to authorize the holding of the Grand Prix without spectators if certain measures are applied. For now, the event is scheduled for June 13, but it's still up to the level of the government to approve the fund. Montreal Mayor Valérie Plante has made it clear that the city can't invest. Premier François Legault said nothing is settled. We were told that because there will be no spectators, there should be a compensation from the government when we have already given a lot, he says. Was it the concern of over the 2022-2029 agreement with F1, Legault said, we don't see why we need the Grand Prix this year. Legault says the Grand Prix is an important event with the economic benefits because of its money that comes from abroad and is spent here in Quebec. He says the event is a subject of discussion at this moment. Earlier today, Prime Minister Justin Trudeau remained vague on this subject. Talks are underway right now, but at the very stage, our priority is the health of the Canadians, and that is the basis on which we'll make the decision, says the Prime Minister Trudeau. Even there's no spectator, the health concern is that the hundreds of F1 staff will arrive on scene, most flying in from Baku, Azerbaijan, where the race is scheduled the weekend before. Reporting from Ottawa, Canada, this is André Lajoie. We live in an interesting time.
As more Canadians receive vaccines, will proof of the vaccination be needed when traveling? Eagle News correspondent Stacey Diocampo with the details.
Canadian Prime Minister Justin Trudeau stopped short of saying that Canada will require people coming into the country to produce proof of vaccination. Trudeau did not give a definite answer when asked about vaccine certificates at a news conference, but says the government is studying the issue. As was the case pre-pandemic, certificates of vaccination are a part of international travel to certain regions and are naturally to be expected when it comes to this pandemic and the coronavirus, said Trudeau. How we actually roll that out in alignment with partners and allies around the world is something that we're working on right now to coordinate. Vaccine passports have been a topic of discussion among the G7 countries. The European Union has indicated fully vaccinated Americans will be able to freely travel in this region this summer. But Trudeau says Canada is too ready to announce any travel measures yet. I can assure you that our decisions will be based on science, and the fact that those decisions are ongoing means that we will be aligned with our partners around the world, he said. In Montreal, Stacey Diocampo will live in interesting times.
The province of Nova Scotia is the latest region of the country to receive help from the military. Eagle News correspondent Melanie with more.
The province of Nova Scotia is receiving help from the Canadian military to beat the third wave of COVID-19. According to Prime Minister Justin Trudeau, he will deploy 16 Canadian Armed Forces members to testing centers in Nova Scotia, particularly in Halifax region, to help to stop the spread of the virus. In addition to, the federal government allowed sending some Canadian Armed Forces in Ontario to give support to hospitals. Also, a team of nurses and doctors from Newfoundland and Labrador will also help out to beat the coronavirus in the province. Newfoundland and Labrador are already organizing a second team of healthcare workers who will rotate in to help, said Justin Trudeau. However, other parts of the country are also feeling the effects of the third wave. In Alberta, the rate of infection is the highest in the country. If that will happen, the virus is spreading faster and the numbers will grow up. The help that is given for Ontario healthcare will be the same for Albertans. According to Justin Trudeau, the outcome of this operation is to keep safe all Canadians across the country. In Ottawa, Canada, this is Melanie Ronquillo. We live in interesting times.
Alberta brings in more restrictions for COVID-19 hotspots in the province. Eagle News correspondent Thomas I. Likeness reports.
The third wave of the pandemic is on a rampage through the province of Alberta, jeopardizing the ability of our healthcare system to treat patients. Alberta Premier Jason Kenney.
Right now, there are more than 21,000 active cases in the province. That's the most we've had since the beginning of the pandemic.
Just 3 weeks ago, the province took a step back and reimposed restrictions from the second wave. That was supposed to help. Did they?
The restrictions currently in place will not bend the curve fast enough to get this third wave under control before the summer.
So what went wrong, Mr. Premier?
The vaccines didn't arrive fast enough, and with hospitalizations continuing to rise, we're left with no choice but to take further action.
So what's ended up happening? A few more restrictions have been imposed in areas with high case numbers. Things like moving junior and senior high schools to online learning, canceling all indoor sports and fitness activities, and asking restaurants with outdoor service to ensure that patrons at a table are from the same household. All in all, not too severe. Despite having the highest infection rates in Canada, there's no major lockdown, no stay-at-home order. So what happens if these measures don't work?
And if we continue to see current levels of case growth, then we will consider bringing forward additional restrictions.
Public opinion polls give Premier Kenney the lowest rating in the country when it comes to how the pandemic has been handled. In his own party, elected members are split on the way he's managed things. All in all, Kenney's latest plan for the pandemic could be described as a political band-aid applied to a hemorrhaging province seeking treatment in the public health emergency room. Thomas I. Likeness, Eagle News. We live in interesting times.
If you were hoping to receive the AstraZeneca vaccine in British Columbia, you may be out of luck. The province is almost out of the vaccine and no more is expected in the short term. Here is Eagle News correspondent Vanessa Condi with the details.
As BC is underway with the COVID vaccinations, there's been a program where you can get the AstraZeneca vaccine through appointments booked at community pharmacies. The location availability are mainly for where the COVID-19 hotspots are. When the eligibility of the age range dropped to 30 and over, this led to many people lining up for hours for the vaccine. However, the demand for the vaccine had exceeded the current supply available in BC pharmacies, and organisational failures and some pop-up vaccinations had led to frustrations, as Dr. Bonnie Henry has mentioned.
But yes, there were some operational things that were done or not done that caused a lot of frustration, and I can see that, and I absolutely apologize to people for the miscommunications and for the confusion. That was certainly not the intent.
All the current AstraZeneca vaccine supply is expected to be fully used by next week.
There's very little AstraZeneca left in the province right now.
Just really briefly, Colton, about 180,000 doses of AstraZeneca have been administered through pharmacies, which I think is an extraordinary achievement. There's about 10,000 left out there.
Dr. Bonnie Henry has said they are not expecting more AstraZeneca vaccines in the short term, but are expecting enough for second doses. In Victoria, BC, Vanessa Condi, Eagle News, we live in interesting times.
Coming up, Toronto's food kitchen receives aid from the Church of Christ. In sports, the Vancouver Canucks continue to recover following team's COVID-19 outbreak. And we explore the health benefits of dandelions. Eagle News Canada continues after this.
factual.
We have to defeat the virus everywhere.
Timely information. Balanced, not only in the country, but also abroad.
I'm certain of one thing.
Interviews that people need to know. Watch Agila Pilipinas! A one-hour newscast of reports coming from regional hubs in Luzon, Visayas, and Mindanao. Know the important updates in Asia in ASEAN in Focus. Track the latest stories in the provinces in Agila Probinsya. Tune into Mata ng Agila, the evening primetime news program of Net25. Balanced and objective, Mata ng Agila covers national and international issues, tackles news on business, health, science and technology, entertainment, sports and human interest features, and current events. And Eagle News International delivers the latest global reports, impartial, accessible, and up-to-date. It brings to fore EBC's rich international scope and access to valuable information streams.
Well, thank you to the Flames, our help outdoor.
Catch these programs on Net25. You can also watch our news programs through eaglenews.ph and Eagle News Facebook page and YouTube channel.
Welcome back. You're watching Eagle News Canada. I am Tiffany Alisasis from Calgary, Alberta. Eagle News correspondent April Masungsung tells us how the Iglesia ni Cristo or Church of Christ in Toronto helped the 5N2 kitchen. April?
Hunger has always been a global issue, even before the COVID-19 pandemic. More so now that the economy is down and millions have lost their jobs due to the COVID-19 crisis. 5N2 Kitchen, a soup kitchen and food bank here in Toronto, Canada, has written to the Felix Y. Manala Foundation to seek their assistance in providing food support for marginalized communities in the city. To prepare for this campaign, members of the Church of Christ collected food donations from their members for a week. 312 boxes of food were prepared, amounting to 9,360 pounds of food items. On top of the food donations, the Church of Christ also donated $5,000 in cash donation to further help 5N2 kitchens.
I want to thank Executive Minister Eduardo V. Manolo. I believe God had his hand on this mission, and you responded in an amazing way, and you gave a directive to the district minister here in Toronto. And in the short space of 2 weeks, the congregation here answered the call, and they've collected this amazing amount of food supplies to help us at 5N2 to be able to support our more needy communities around us. There are so many marginalized families here in Toronto that fall into the cracks because they don't speak up about the poverty they're facing, and especially at these times when they're isolated and at high risk of exposure. The supplies that you have enabled your congregation to gather for us is tremendous, and I think maybe for the rest of this year you likely will not have to buy certain supplies because your congregation has brought it together to us. And so I want to thank you again for this, and I pray God will guide you, give you wisdom and understanding as you continue to do His work in the many countries that you are carrying these ministries to. Thank you very much.
Indeed, food stability may be a rarity these days, but the Felix Y. Manala Foundation is proof that generosity and community will never be scarce, even in times of a global pandemic. In Toronto, April Masongsong, Eagle News. We live in interesting times.
In sports, the Vancouver Canucks season was put on hold after being victims of the National Hockey League's worst COVID-19 outbreak this season. EBC sports correspondent Anthony Sevilla with the details.
In mid-March, 21 players and 4 staff members of the Vancouver Canucks tested positive for a variant of the virus. Consequently, this outbreak caused the team to postpone 6 of the regular season games and kept them off the ice for almost a month. Following discussions with the Players Association, the team returned to the ice after a 3-week break to play at a grueling schedule of 19 games in just 24 days. Players shared their encounter coping with the virus and the symptoms they experienced during the recovery period.
It was a tough 3 weeks. It wasn't easy for anybody who got it, and especially, when it starts hitting families, it's really tough. And, it takes a lot out of you. You experience symptoms you've never really experienced in other flus and colds and stuff like that. So, I'm feeling a lot better now. I'm one of the lucky ones that, my symptoms were fairly mild. Obviously, I had a couple of symptoms, but, I got through them and continuing to get through them.
I really lost track of my dates here, but I guess I'll say that the morning I first tested positive, found out later in the day. It was kind of through the night that night. It pretty much just felt like you had a bad flu. I had the sweats in the middle of the night and the fever and headache, and just felt crappy for probably about the first 24 hours was really rough, where you really don't want to leave your bed. You're kind of just laying around. Some guys on the team had it far worse than what I had. And some guys obviously felt a little bit better, but that's the thing about this virus. You find out everyone's got completely different varying symptoms of what they feel and how they feel now, how they felt 2 weeks ago. Very unpredictable. So, again, I'm just thankful that we're doing all we can to prevent it. And unfortunately, it just got a hold of us.
I don't know if, anyone's really at 100. I know COVID took a toll on us, and obviously it's tough taking that much time off, but we got a job to do to come in and win some games here, and that's what everyone's geared towards and ready to do.
In a post-practice interview with Travis Green, the Canucks head coach had some words of encouragement to the residents of British Columbia regarding this pandemic.
If I could tell the people of BC, continue to do the right things. Listen to the health authorities. I know we're getting into this pretty long now, and it's not time to loosen things up yet and not do the right things. You don't want to get this. I can say that personally. It's it wasn't easy at times, and it's not a joke. You don't want to get it, and you don't want other people to get it. You don't want loved ones to get it. And we've got to stay the course here.
Over the past 2 days, no new cases have occurred, which has been a good sign for the team going forward. However, the Canucks will face the challenge of playing through a schedule that consists of 19 games in just 24 days. The team trails the Montreal Canadiens 10 points for the last and final player spot in the Western Conference. In Vancouver, Anthony Sevilla, Eagle News. We live in interesting times.
Did you know that dandelions are not just pesky garden weeds? Eagle News correspondent Jeanette Duzo tells us about their health benefits. Jeanette.
Today we will talk about a plant that most people think is a pesky garden weed. Dandelions. Dandelions tend to flower abundantly in spring and easily recognizable with its bright yellow flowers. They produce seeds after the flowers close. As the seeds mature, the stalk grows out, exposing the white fluffy seed head that gets blown away by the wind. The dandelions always have new generations waiting for spring to come around, and there seems no one can ever get rid of them on their lawns. Dandelion is actually an herb that is native to Europe and also found throughout mild climates of the Northern Hemisphere. Dandelions are members of the sunflower family with about 100 different species around the world. The most common variety of this plant is called Tarsacu officinale. For several centuries, people have used dandelion to help treat ailments. People use the leaves, stem, flower, and root for medicinal purposes. Dandelions are rich in nutrients and could be helpful additions to a person's diet or supplement. As with using dandelion for supplement, there may have side effects or may cause allergic reactions in some people, which may include interactions with other medications. According to Medical News Today, there are several potential benefits of dandelion. All parts of the plant dandelion can be consumed. Leaves for salad, roots can be used as coffee substitute or tea, and apparently can make green and yellow dyes from the flowers. I myself have tried using them as I would in some meal preparation, as an addition to a lot of different kinds of soup like sinigang, tinola, and ginisang munggo. Foraging for dandelion should be done safely. Roadside or backyard may be unsafe if the dandelions are exposed to vehicle exhaust fumes or pesticides and animal excrement. So in here, we can see that they're just sprouting. They're right underneath this big tree where we know that no one will care that they are here. So they are not sprayed with anything like pesticides, and it's in the middle of this kind of mini forest, so they're not exposed to exhaust from any vehicles. This is a good spot to forage for some dandelions. As the saying goes, if life gives you lemons, make lemonade. In this case, if you have a yard full of dandelions, eat and drink them. In British Columbia, Jeanette Tuazo, Eagle News. We live in interesting times.
That's today's Eagle News Canada. Join us again next week as we bring stories that matter to you. Visit our website at eaglenews.net and eaglenewslive.com. Follow us on Twitter at twitter.com/eaglenews and on Facebook at facebook.com/eaglenews. Thank you for watching. I am Tiffany Alisasis. We live in interesting times.